And surgery that tens of thousands of women have every year.
CBS 2's Dr. Max Gomez explains new information shows the device could actually spread undetected cancer.
Stage 4 leiomyosarcoma, medical jargon for advanced pelvic cancer. It's the last thing Amy Reed thought she'd be dealing with 6 months after having uterine fibroids removed.
It was very hard initially. The level of anxiety is horrible.
Reed had her tumors removed laparoscopically using a device called a morcellator, which shreds the tissue so it can be removed through the small, minimally invasive incisions. What she and her doctors did not know is that she had cancer in the wall of her uterus, and morcellation made a bad situation much worse.
If you cut that tumor in pieces inside of the abdomen, there is a potential of spread of the cancer throughout the abdomen. So that makes the stage of the cancer more advanced.
Nobody wants to hear you only got maybe 12 months left to live or less.
Something similar happened to Brenda Luzzi. She had hemorrhaged several times from large uterine fibroids, and she opted for the same laparoscopic surgery with morcellation.
They took a tumor that was at a low stage and morcellated her. Now she's at a high stage.
The risk of spreading a pre-existing cancer with morcellation is concerning enough that the FDA has issued an advisory that, quote, discourages the use of laparoscopic power morcellation during hysterectomy or myomectomy for uterine fibroids. But it turns out it's not quite so straightforward.
Clearly, not every case should be morcellated. However, to not morcellate anybody would be a tragic error because many women will benefit from minimally invasive surgery.
Dr. Stephen Goldstein is a professor of OB/GYN at NYU Langone Medical Center and past president of a number of GYN societies. He says it's possible to tell when it's safe to use a morcellator.
I may not be able to definitively say that something is cancer, but I can often definitively say that something is not.
The chief of robotic surgery at NYU Langone says that minimally invasive surgery reduces many of the complications of open surgery for fibroids,
such as blood loss, infection, blood clots, which could also be lethal, and the recovery time for minimally invasive surgery is significantly shorter.
There are ways to tell a fibroid may be malignant. A special type of MRI, blood flow sonograms, age, rate of growth of the fibroid, and so on, that allow doctors to determine whether it's safe to morcellate. The key is to individualize the approach for each patient. Dr. Max Gomez, CBS 2 News.
And Dr. Max adds that NYU and several GYN societies have said the morcellator should continue to be used in the right cases. Talk to your doctor.
You bet.